Carpal tunnel syndrome is a condition that affects the wrist, hand and fingers and tends to affect the thumb, index finger, middle finger and half of the ring finger, as is shown on the model. Taking a closer look beneath the skin, we can appreciate the carpal tunnel in a little more detail. Running across the top of the carpal tunnel, we have this ligament known as the transverse carpal ligament or flexor retinaculum. This is the top of the carpal tunnel. Running beneath it, you have the nerve that is affected in carpal tunnel syndrome highlighted in pink above, and running below there, and it's called the median nerve. In carpal tunnel syndrome, this median nerve becomes compressed within the carpal tunnel, giving rise to the symptoms described previously. First-line treatment for carpal tunnel syndrome is often to wear night splints and combine this with some tendon and nerve exercises. The night splints can provide good temporary relief alongside the exercises and for many symptoms resolve. However, for some people this doesn't improve symptoms and injection therapy of steroids can be considered. Here we've removed some of the anatomy so we can highlight the carpal tunnel a little more readily to appreciate how an injection would be administered. Within the carpal tunnel we can see the median nerve, now highlighted in pink. Injections are administered from the left hand side of the screen in this instance and would be targeted around about the nerve, but importantly avoiding the nerve itself and important arteries within the vicinity. Here we see the line of the needle for injection and the injectate or the steroid administered around about the nerve. Here we can see an ultrasound image of the carpal tunnel just prior to injection. The median nerve has been circled. Now we see the flexor retinaculum being outlined over the top and the ulnar artery on the right hand side of the image circled. Then highlighting the tendons, flexor tendons of the fingers that sit within the carpal tunnel, and then a line indicating where the injection is administered from. Now we see the live video feed of an ultrasound guided injection. Needle coming in from the left of the screen, guided just to the periphery of the nerve, and then the injection of steroid safely delivered around about the nerve at the exact location. For some people, despite injection, symptoms may persist. In these circumstances, surgical release of the carpal tunnel can be considered. This would involve surgical release of the flexor retinaculum, if you like the roof and top of the median nerve, as illustrated here.